Rachel. I'm a dental hygienist and I'm creating this video because I have a lot of patients ask me what is the best electric toothbrush to use. So today I'm going to be reviewing the Oral-B Pro 8000 and the Sonicare Diamond Clean Smart. And these toothbrushes are the latest and newest of both brands. So we'll start out with the Oral-B. This one is my favorite one to recommend, and I'm going to show you why. This one retails for about $179 on the Oral-B website, and the brush heads are $17.99, and you can maybe even get them cheaper depending on where you buy them. And I always tell people you can buy them at the website for Oral-B or Target, Amazon, Walmart, those types of places. I don't recommend getting them at CVS or any drugstore because they're going to be a little bit more expensive. So with these brush heads, by the way, you can use them up to 3 months, and then after that you want to discard them. And these come with about 3 in a pack, so you don't even have to buy a new one for about 9 months, which is pretty good. But if you see the bristles kind of flaring, that means that you're brushing too hard and you should replace it sooner than the 3 months, okay? And we're going to get into the details about this toothbrush. This toothbrush is also called a Braun, but I call it Oral-B. It is called Pro 8000. There are cheaper versions out there, which I do not recommend. I recommend it if you're on a budget and you want to spend only a certain amount on an electric toothbrush, because it is still better than a manual toothbrush to use any electric toothbrush, in my opinion. And there are battery operated ones. This one plugs in the wall, so you just charge it on the charger every day, and it lasts about 12 days if you don't put it on the charger. Say if you're traveling, it can last you up to 12 days. Now, it oscillates and it rotates instead of like vibrating, which Sonicare vibrates. It doesn't rotate all around, and I'll show you that in a second. And this is a #1 dentist recommended, so they claim on their website, which I do agree with. I always recommend this to my patients. You can personalize the color up top, which is pretty cool. It does come with the Bluetooth app. It has a pressure sensor. This will turn red when you brush too hard, which I'll show you that too. It has a 2-minute timer. I'm going to show you now how it brushes. So I'll show you the tooth model here, and I'm going to show you how I recommend my patients to brush with this toothbrush. As you can see, it rotates around. So you want to just go from side to side. So never brushing directly on the gum. And I'm going to turn it off so you can hear, but when I'm brushing in this part, I kind of just let it go. I can turn it this way to angle it, and you just want to let it go inside there for about 30 seconds. This is one area where a lot of people develop a lot of plaque, so definitely focus there a little bit more. When you're brushing the sides, you never want to brush directly on the pink part, which is your gum. You never get the gum tissue back if you remove it by brushing too hard over the years, so you want to just keep it just like this. And then you don't have to do this circle motion like a lot of people, you do that with your manual toothbrush. You don't have to do that with this toothbrush, which is really awesome. You just glide it along like I showed you. And then when you brush too hard, which is another cool feature I'll show you, it turns red. So that will let you know to stop brushing so hard. So the reason why I recommend this toothbrush over the Sonicare is because it has a small brush head. As you can see, round, small, it rotates. It gets into those areas, for example, like right up here where a lot of people have trouble reaching. It really helps to brush there, and I see such a big improvement with patients that use this toothbrush versus a regular manual toothbrush. I have made a lot of patients make the switch, and they have had great results, and I couldn't be more proud. So that's it for the Oral-B. If you have any questions, let me know in the comments, and I will put the information down on where you can buy this toothbrush. And one more thing I wanted to say, it does come with that Bluetooth app, which it can tell you what spots you missed while brushing. It kind of just goes along with you, and it knows where you're brushing. So that is one added step that you can take if you get this toothbrush, that you can really try to follow the guidelines of correct brushing. That way it just is like a helpful tool. I've used it once, and I also use it to customize my color to make it pink here. So you can do that too. And then more about this toothbrush I will leave in the details below. But again, it is just such a great tool, and I highly, highly recommend this one. All right, and next we're going to review the Sonicare. All right, so this is the Sonicare Diamond Clean Smart. It is the newest toothbrush that they have as far as electric toothbrushes, and this one retails for $199.95. A little bit more pricey than the Oral-B, which is another reason why I don't recommend it as much. It's just a little bit too much for some people, which I totally understand that. It comes with brush heads when you buy the box. So does the Oral-B. They give you 3 to 4 brush heads in each box. And this brush head in particular is a little bit more pricey as well. The whole box of 3 is $26.95 on their website. And again, you could find it for cheaper somewhere else, like Amazon or Target, Bed Bath & Beyond, Walmart, places like that. This toothbrush does have a lot of similar features to the Oral-B. The main difference is it has a different shape brush head. As you can see, it's like an oval shape. So it does come with 5 different modes that you can choose from. One is tongue care, one is deep clean, one is gum health, one is whitening, and one is clean. I typically use the just regular clean setting. It's just a little bit less intense, so I recommend starting on that one. The gum care, I would never really use that. I mean, maybe it's just a lighter setting, but you never want to brush your gums, so I don't understand why they have that on there, but it is kind of misleading because some people probably take the toothbrush and brush their gums with it, which is not what you're supposed to do. Like I said, that gum tissue is so important, and you don't want to brush it away. And the deep clean is just a stronger setting if you want a little bit more of a clean. The tongue care, you should put the tongue brush heads, like a tongue scraper brush head that you can buy that they sell, and you just put it on here and then you brush your tongue. So just another tongue scraper basically. And probably I would just buy a tongue scraper because I'm sure the brush heads are a little bit pricey. So but you do want to brush your tongue every single day. It does help remove a lot of bacteria in the mouth. And the last setting on here that I don't think I talked about is the whitening. That can also be very misleading because it does not actually whiten your teeth. It just removes probably a little bit more staining, probably a stronger setting, and that's why they call it whitening. But toothbrushes themselves will never whiten your teeth, only remove stains a little bit better, and that's why they appear more white. Okay, so other things about this toothbrush are they have 3 intensities, so like low, medium, high. I always do the low. I feel like that's just better for me, less sensitive. I do get sensitivity. I do find a little bit more sensitivity with this toothbrush, so I just like to tell patients that as well if they do experience sensitivity with this toothbrush. I have heard many patients tell me that they do, but I just recommend the lowest setting possible and to use Sensodyne toothpaste. Again, when you brush with this toothbrush, it's just very different because of the brush head size. So I'm going to go ahead and show you the correct way to brush with it, okay? So you want to angle it like that. Again, never like that. And then you can tilt it like this to get the insides. I would do 2 to 3 seconds for each tooth. And if you brush hard, it turns that light on. So it does have that pressure sensor, which is awesome. So overall, this toothbrush is very, very powerful. It is very good at removing plaque, definitely better than a manual toothbrush. The features are really nice. It's very easy to clean. And I do think it does a great job. But since if I had a choice when I do with my patients recommending which one I would choose over the other one, I do recommend the Oral-B. So in my opinion, Oral-B is the great alternative to the Sonicare, and it's cheaper. The only difference is just the size of the brush heads, and just maybe it has a little bit less, you know, features on the Oral-B, but they both have those different modes and intensities, and they both do, you know, exactly the same thing. It's just this one performs a little bit better when removing plaque and getting into those hard to reach areas. So if you guys have any questions, let me know in the comments, and I'll look forward to seeing you in my next video. Thanks for tuning in, and please subscribe. I would do 2 to 3 seconds for each tooth, and if you brush hard, it turns that light on. So it does have that pressure sensor, which is awesome. So overall, this toothbrush is very, very powerful. It is very good at removing plaque, definitely better than a manual toothbrush. The features are really nice. It's very easy to clean, and I do think it does a great job. But since if I had a choice when I do with my patients recommending which one I would choose over the other one, I do recommend the Oral-B. So in my opinion, Oral-B is the great alternative to the Sonicare, and it's cheaper. The only difference is just the size of the brush heads, and just maybe it has a little bit less, you know, features on the Oral-B, but they both have those different modes and intensities, and they both do, you know, exactly the same thing. It's just this one performs a little bit better when removing plaque and getting into those hard to reach areas. So if you guys have any questions, let me know in the comments, and I'll look forward to seeing you in my next video. Thanks for tuning in, and please subscribe. I would do 2 to 3 seconds for each tooth, and if you brush hard, it turns that light on. So it does have that pressure sensor, which is awesome. So overall, this toothbrush is very, very powerful. It is very good at removing plaque, definitely better than a manual toothbrush. The features are really nice. It's very easy to clean, and I do think it does a great job. But since if I had a choice when I do with my patients recommending which one I would choose over the other one, I do recommend the Oral-B. So in my opinion, Oral-B is the great alternative to the Sonicare, and it's cheaper. The only difference is just the size of the brush heads, and just maybe it has a little bit less, you know, features on the Oral-B, but they both have those different modes and intensities, and they both do, you know, exactly the same thing. It's just this one performs a little bit better when removing plaque and getting into those hard to reach areas. So if you guys have any questions, let me know in the comments, and I'll look forward to seeing you in my next video. Thanks for tuning in, and please subscribe.